Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Alina Urriola. She is a family physician, and she wrote the Kevin MD article, "What are your health goals for the coming year?" Alina, welcome to the show.
Thank you, Kevin. It's a pleasure to be here.
We'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. I'm a family physician. I'm originally from Panama. I went to medical school in Brazil, Latin America, 6 years from high school. Finished medical school, went back to Panama and did my residency in family medicine. Initially, when I was in Brazil, I thought I was going to do infectious disease because where I went to medical school, in order to serve the most, that was the primary concerns and the primary need. But then when I went to Panama, back to my country, infectious disease in the early 80s were antibiotic consultants and then AIDS physicians. So it was very limited and it didn't have that broad sense that I wanted. I wanted to help the most. So I discovered family medicine and did my residency, and then migrated to the United States, did a residency again in St. Louis, and finished also a residency in preventive medicine with a master in public health. I have been a family physician for almost 3 decades, and I enjoy the breadth of the specialty, and especially the continuity of care, the contact with patients, the opportunity that I have to affect patients' lives.
So you did your training in Latin America, and then now you came up here to the United States. You've been in the United States for a while now. What would you say are the biggest differences that you've noticed practicing in the United States versus your home country?
So in my home country, family medicine is not fully recognized as a specialty. People still look for the specialist. I have to convince my mother that she doesn't need an endocrinologist for her diabetes and a cardiologist for her hypertension. There's still not the strength of the specialty and the confidence in the physicians. And I feel really fortunate to be able to practice to the breadth of the specialty and take care of all my patients' needs.
So we're talking in the beginning of February now, and hopefully the pandemic is beginning to die down with the advent of the vaccines. Tell me what you're seeing through your lens as a family physician as it relates to the pandemic.
Where I am in Seattle, it was the first place where the infection was found, but the state of Washington was very quick at setting the rules of mask use wearing and limiting the agglomeration of people. So we've been very fortunate here. We still are very careful. Right now I am doing a locums in Indian reservation in the state of Oregon, where they also they were very caring for their community, and they have been quick to test everybody. The efforts for testing in this tribal group was very, very strong and very well coordinated, as well as the effort for immunizing their population. They are much more ahead of the rest of the country. And I feel like here in Washington, we were also quick at separate primary care from acute respiratory care. So we were able to continue taking care of our diabetics, our chronic disease patients. So that was very important. It was a very important move that the state of Washington did, and where I'm working now in Oregon to continue the care of the patients who were not affected by the pandemic.
All right, so let's transition now into your Kevin MD article that you wrote at the beginning of January. It's simply titled, "What are your health goals for the coming year?" Now, for those who didn't read that article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah. So, January, everybody set goals and resolutions. I reminisce about my own medical practice in which every year when my patients come for their physical, after the regular introduction and whatever greetings, I ask, so what are your goals for the coming year, your health goals for the coming year? And as I wrote in the article, that question was received by a surprise. Like, what do you mean? Are you going to examine me? Are you going? So it's like, well, let's talk about it. This is your opportunity. This is your preventive visit. And this is your opportunity to examine, what do you value? What is important to you in terms of your health, your relationships? So let's talk about what is important. And as I wrote in the article, invariably, it was so funny, Kevin, even 120-pound fit women would say, oh, my goal is to lose weight. And so in the beginning, I was like, okay, weight loss is the goal. But it's like, wait a second, what did you achieve by losing weight? What do you really, who would you be if you lost weight? How losing weight will make you a better person? And that's when the conversation really started. And I learned, their functional status is very important. And nobody was willing to say, I want to look good. And I by opening and giving permission to say, I want to fit in my jeans. I want to wear a bathing suit. I want to disrobe in front of my loved one on plain light. I mean, that's powerful. Getting into those intimate fears and needs and wants. So that's when the conversation started. Curiously enough, I mean, I've been doing this for 3 years, and every year I review the goals. And after a year or two, patients have focused on other things. I mean, they want to be stronger or be better or achieve things that are more important. Sleep, which is very, very important. Be able to meditate, be able to connect better. So that journey of getting to allow my patients to examine their values and see what is important to them was very enriching for me.
So when you ask patients, what are your health goals for the year, and they haven't thought about it, they're taken aback, what are some of the techniques that you use to really get them to think about their goals and to get the patients to open up to you in the exam room?
So it's all about values. And because I have gone through that myself, examine my values. I mean, Kevin, I have a personal mission, vision statement. Elicit what is important to you. What do you value in life? In our life where everything is rush, 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 work, 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 we're not given the opportunity to sit back and examine our values. And I mean, in medicine, you may argue that that's not a doctor's role, that I should be, auscultating, lungs clear to auscultation, heart regular rate and rhythm, abdomen soft, tendon, rhombosis, megalinea, vowels, the what we write in notes.
Mm-hmm.
But I think that one of the things that fascinate me the most is the power that people have to take care of their health, and they are not allowed, they are not given that permission, that they have the power to take care of their health, set their own health goals. I am one who asks permission to the patients. What do you think about starting this medication? We can do this, or we can do that.
Mm-hmm.
We can do nothing. What do you think? Engaging patients into the process of deciding what they want for their health, what their health is. Because Kevin, they close the door, they go and they will do whatever they want. I can prescribe anything I feel they need, but if they are not engaged, they are not going to do it. So we face with lack of compliance with medication, no shows. All those things happen because patients are not empowered to be the owners of their own health. by transmitting the message that they can take control.
Mm-hmm.
It's like a permission that
Mm-hmm.
I give them to tell me what is the most important thing for them. And that permission allows them to say, well, yeah, this is important. My patients have grown to value those things, and that's what they come back for.
And I think it's wonderful that you give patients that time so they can examine their values and empower patients to take control of their own health. A lot of times in primary care, as you know, there's
Mhm.
more and more things for us physicians to do in the exam room. Electronic medical records require us to check boxes, and administrators are telling primary care physicians to see more patients in
Mhm.
decreasing amount of time. Now, a lot of what you're saying takes some time in the exam room. So how do you manage as a primary care physician to have these conversations with patients in the light of all the increasing pressures and stresses and dwindling time that primary care physicians face?
Well, that's exactly. So I don't think that I'm privileged, but I think that everybody is allotted a longer time for a physical. People work in 10, 20s, and 40s. I work in 15, 30s, and very rarely 45. A physical exam, which we know that there's no evidence that a physical brings any benefit. We are allotted 30 minutes,
Mhm.
so we have time. We don't have, I mean, other than the pap smear every 5 years or a breast exam, we don't have to examine a patient. So we have time to do that once a year. In the rules for billing a physical exam, nowhere says that you have to examine the patient.
Mhm.
It's a yearly health maintenance, and that's what we're paid for. And I think that talking about health values is more important than spending disrobing a patient and examining. I mean, there are things that we have in the elderly. We need to examine gait. We have to examine range of motion, safe things that are related to their safety. But most people, we don't have to examine.
We're talking to Alina Urriola. She is a family physician and she wrote the Kevin MD article, What are your health goals for the coming year? Alina, for my primary care clinician audience who may be listening to this podcast, what are some examples of questions that you ask patients in the exam room to get them to re-examine their values? Are there any specific go-to questions that you have that gets them to open up?
I think that it's very simple. It's just what is important to you,
Mm-hmm.
what a healthy you looks like. Because again, going back to the fixation, I mean, and I think that weight is an epidemic, obesity is an epidemic, and we have to address it. But the fact that patients only see that little part of their self as something that they can achieve to be different. So my question is how a healthier you looks like. If it looks lighter, that's good. But what else?
Mm-hmm.
So it's very simple.
And my final question, what is your take-home message that you want to leave with the Kevin MD audience?
Go beyond the task. Think about how can you better enhance patients' life. Get to know your patients. Thinking also, this is something that is fascinating to me, Kevin,
Mm-hmm.
is why people are, what is health? We have exhausted illness in medicine. We know everything about illness, but we know very little about health. So we need to get more curious about health. What people believe health is, where do they want to bring their life from the where they are to their healthy self, what
Mm-hmm.
that is, and learn more about how can we can create a health contagion, how we can make health a transmissible this condition, so we can promote well-being among our patients.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin.